الحمد لله رب العالمين والعاقبة للمتقين والجنة للموحدين ولا عدوان إلا على الظالمين أشهد أن لا إله إلا الله وأشهد أن محمدا عبده ورسوله. It's an honor to hear Dr. Badi. That was an honor to hear what he had to say. And I'm sitting and I'm really shocked actually at our parallel history. You might not know that Insight in the United States began in 2007. Indus started in 2007 here. The budget and the growth and so on seems almost parallel to what we're doing. Insight, Indus, I'm trying to make a connection. Thus means 10, 10 out of 10. Sight, vision, we're looking to becoming more excellent. So I see a very parallel idea in the heart of Dr. Badi. And I am very excited to see how we can collaborate in multiple ways. And this tells me more that this isn't something coming from any one of us. This is an ethic that lies inside of us. Allah subhanahu wa ta'ala, He put it inside of us now to achieve something that others don't see. If you look at medicine right now, it's being very much affected by materialism. Currently in the United States, we do the most percentage-wise charitable work compared to any institution in the United States. People have insurance, they come to us. They can't pay, they come to us. Illegal immigrants, they come to us. So the idea that our goal is to now to deliver medications and to deliver treatments. And I'm really incredibly in awe of the work that's been done by Indus, the growth, the barakah from Allah subhanahu wa ta'ala that allowed it to grow this way is just really, you feel it in this institution. So I hope that we can collaborate, and I hope that we can become sister organizations, inshallah. So today I'm presenting something which is called cranial-based surgery, and maybe it'll give a little bit of an insight into, I think, what we have to do together. So cranial-based surgery is a type of surgery where you have to get to the brain. Most of the time when you operate on people's brains and it's superficial, it's easy to get there. You make an opening in the skull, you remove the tumor, you do whatever surgery you have to do. The difficult problem is the brain stem. That how do you get to the brain stem? How do you get to the base of the brain? Because the most difficult access points are now to those areas. So in order to dissect and find those areas, I wanted to present something around this topic. So this is something which speaks to our ethics. This is a young child. He was 4 years old in the United States in Michigan. His name is Dominic Calhoun. I can't really forget his case. He was 4 years old, and when I saw him, he had arrested 3 times. Finally, when I came to the operating room, they had him set, and by then we weren't sure he was going to survive. I opened his brain because of the contusions and hemorrhages in his brain, and almost 1/3 of his brain came almost in my lap. As soon as I opened it, I knew that he's not going to survive. I removed his clothing. I wanted to go speak to the family. I hadn't seen him except in the operating room. Every single part of his body bruised. Old bruises from 3 weeks ago, 2 weeks ago, bites, bruises. Someone had been hurting him for 3 weeks. 3 weeks, his mother's boyfriend was beating him, hurting him. Nobody came to his rescue. The neighbors, they heard voices. They actually heard this child screaming. Nobody knocked on the door to say, what's going on here? Finally, when the police brought him now to the hospital, there's no way he could survive. So this 4-year-old child depended on the community, the physicians, the government, the people. Everybody failed him. Everybody failed him. That this young 4-year-old, every part of his body bruised, beaten, and so on. So they established a law in Michigan with his name. And it just, once again, reminds me what we're trying to achieve, whether here in Pakistan, in the United States, or anywhere in the world. So the idea of what we have in front of us, there's a poem, I love to say this, that many people believe it's Iqbal. Actually, it's my grandfather. It's a very famous poem in Pakistan where the poet says, "Tundi bade mukhalaf sana ghabrae uqab, ye to chalti hai tujhe uncha urane ke liye." That's obviously you don't have to translate, but it was actually my grandfather who was an orphan and grew up in Shakargarh. near Lahore. And when he was 19 years old, he wrote this poem, and he was unable to go to school. His sister who took care of him was 14 years old and blind. So he went through school from grade 1, 2, 3, finally matriculated, and then he went to law school. And he wrote this poem when he was 19 because of the difficulties in his life. And he said, "Tundi baad mukhalaf sana ghabra uqab ye to chalti hai tujhe uncha urane ke liye." So this is our lives. Every day we wake up with a new challenge, a new difficulty, a new problem, and every day we achieve and we succeed, inshallah, in overcoming those problems. And that's really what we have to do here in this world. So I wanted to present this case just to demonstrate in our area of expertise and an area of collaboration, which is the case of a 51-year-old male who comes in with some minor symptoms and signs, diplopia and so on, but ultimately he gets this extensive workup and he's found to have a tumor. The basic principles of surgery are to remove the tumor and remove the pathology in whichever way possible. So this is where the tumor is. The tumor wraps around the brainstem. This is the basilar artery, and it's very, very deep in the brain. This tumor back in the early 2000s has about a 60% mortality rate of removing it when it's that deep. And the idea that someone can survive these surgeries is relatively new in the era of neurosurgery. If one can take out a significant part of the tumor, when it comes to chordoma, which was what this tumor turned out to be, they have a 50% survival around 50 months. On the other hand, if you have less than 25 cc's of residual tumor and you are able to now do some forms of adjunct therapy, you can have 100% survival for this patient. So one of the difficulties in this case is the access points. This isn't showing up so well, but this is a venogram, and the pen is pointing towards an area which is referred to as the cavernous sinus. The cavernous sinus is in the brain, and it is a location where Oh, here we go. Okay. So this is the anatomical jewel box. So this is an area of the brain which is very difficult to operate in because the carotid artery, you can see, also is surrounded by this venous plexus, and also has multiple nerves going through it. So the idea is that to operate within a blood vessel, you have another blood vessel is what was thought. So people went under circulatory arrest where all the blood would be removed from the body, cool the patient down to 18 degrees Celsius and operate very quickly in that area, similar to the cardiac surgeons. And the idea then was to get into that pathology to start removing tumors. So again, it's a difficult area of anatomy. In this particular patient, this is the inferior anastomotic vein of Lebet, and there's also a vein, unnamed vein, that comes out from that same territory and leaving you a very small crevice here within which to operate, which is referred to as Troutman's triangle. This is a very tiny area of the brain, and you have to use what's called a transpetrosal approach, in which you're going to now shave off the skull. There we go. In order to access the brain, you have to use what's called stealth, and I understand that is available here in Pakistan, where you can use three-dimensional imaging to help navigate to the exact location and ultimately remove the tumor. So as you clean the tumor out, particularly when it comes to chordoma, is that if you don't clean it out, this is what happens. The entire skull gets eaten up and the tumor continues to expand, almost like an infectious disease. It's so bad of a tumor that even as you remove your instruments, it seeds the area. These are fistulifera cells. They look kind of like fat. Ultimately, removing the tumor as much as one can, you have to use every micro technique available. Now, one of the issues one does with the residual tumor is utilizes the gamma knife. And again, it's very exciting for me to understand here in Pakistan, there's gamma knife and cyber knife. And the idea is that you can now burn out the residual tumor where the dimension of the tumor, if it's less than 2.5 cc's. The idea of a gamma knife is that you send in radiation. Each beam of radiation is relatively low intensity, but where they crisscross, you can make a conformal ring around a residual tumor, and you can end up necrotizing it. So not only is it something which changes the DNA of the tumor, but actually it ends up burning or necrotizing the tumor. So again, you can see the effect is that you can ultimately take out residual tumor, and through these techniques, you can achieve excellent results. The problem with any of the photons which are used in gamma knife or any other type of radiation is that there's a drop-off effect. So you see this red line where you radiate the tumor, but adjacent to the tumor, it also gets radiation. So by crisscrossing the pathways, you take away that adjacent burn. But if the tumor is here, how do you maximize radiation to this tumor? One of the ways is a proton beam. So protons, unlike photons, exhibit what's called a Bragg peak, where you're able to give so much radiation at this peak that the adjacent level drops off immediately. So though you're delivering very high levels of radiation, exactly adjacent to it, there's very tiny bits of radiation, and that's what you call a proton beam. And that is what we end up doing for many of these tumors. What's now the new phase is the carbon ions, which are even heavier than protons, and you have even a more precise peak, so you can now, with almost like a laser, deliver radiation deep into these tumors. And we hope one day, inshallah, Pakistan will, with us, lead the way in delivering these sorts of therapies. There's multiple roads into the brainstem. Of course, what we used in this case was referred to as the transpetrosal approach. I bring this case up and I present this with the idea that, again, through attempts to try and take care of a single patient, entire infrastructures can be built that can help larger populations. In the series that we have, there's 13 patients. We achieved radical removal in 12, and overall had excellent results by utilizing the proton beam, as well as a variety of other things that are over and above that. So aggressive safe surgery, proton beam, utilizing stereotactic radiosurgery, high vigilance, etc. But I wanted to point this out, that this is what it takes in order to really achieve success. Medicine and life is a team sport. So it's not enough simply to read a lot, memorize a lot, but look at a team that you need for a successful outcome. Neurosurgeons, neurology, nursing, radiation oncology, radiology, pathology, anesthesia, cranial-based microsurgeries, intraoperative monitoring, EMP, EMG, SSCPs, BEARS, MEPs, vigilance from the nursing staff, et cetera, et cetera. So all these different people, all these different personnel, all their learning, all their training ultimately leads to a single patient getting their life back. So again, this is what excellence is, and that's really what we have to try and achieve. I want to present another case, and this is another case of something kind of crazy, but this is a patient who is drinking and snowmobiling, and he ended up having this stick go through his eye, and you can see how it looks, pretty crazy. And I ended up speaking to him. Surprisingly, he was wide awake. The actual stick, you can see, goes from here all the way through to the back of his brain and back of his neck, and you can see the air in the back of his neck. What he's done now, he's cut the vertebral artery. So you can see the vertebral artery on this side is cut, and if you look on the opposite side, you can see that the vertebral artery has now come up and around a corner and now has delivered blood around the corner. But what's very interesting is that if you look at this cut, it's so precise that if it was a little bit higher, it would have taken out the pica, which would have taken out his brainstem. If it was a little bit lower, it would have ended up causing a dissection, and the patient would not have survived. Somehow, it's kind of the perfect surgical cut. Now, I want you to take a look at that, and I'm going to digress a little bit, and I want to just talk a little bit about this anatomy. That this is the basilar artery. So you see the vertebral coming up this way. This is a vertebral artery. And you can see it bends as it comes up the neck. And then it comes up, and that straight artery there is called the basilar artery. Now, for those who aren't in the neurospace, that is the most important artery in the body. And I want to just go back and talk a bit about the Quran, because our approach to life and medicine should be very different. That there's an ethic that emanates from our deen and our teachings that is very important to understand. There's a verse in the Quran that's, I believe, wrongly translated, where Allah subhanahu wa ta'ala says, وَلَقَدْ خَلَقْنَا الْإِنسَانَ وَنَعْلَمُ مَا تُوَسْوِسُ بِهِ نَفْسُهُ وَنَحْنُ أَقْرَبُ إِلَيْهِ مِنْ حَبْلِ الْوَرِيدِ. So the word hablul warid in Arabic is what people translate as the jugular vein. That Allah subhanahu wa ta'ala, وَلَقَدْ خَلَقْنَا الْإِنسَانَ, we created human beings. وَنَعْلَمُ مَا تُوَسْوِسُ بِهِ نَفْسُهُ, we know what whispers in their souls, and we're closer to them than the jugular vein. Jugular vein was something which was introduced into tafsir literature in around the 1700s. And that was primarily by American or English anatomists. And they said that there's these two large vessels called the jugular vein. Probably that's what hablul warid is. Prior to that reference, there's no reference in all Islamic dictionaries or in old Islamic poetry that this was the jugular vein. In fact, Ibn Ashur, he writes in his compendium when he talks about the origin of the meaning of words, that warid refers to artery, not to vein. And because the word warada, to carry something to something else, it refers to the idea of carrying something to the end organ. So it's an artery. The second thing he points out is hablul warid, not hablain. It's one single vessel, hablul warid. And third, it's intimately associated with consciousness. مَا تُوَسْوِسُ بِهِ نَفْسُهُ. It's intimately, by ijma' of the ulama, it's related to consciousness. So the idea that there's only one artery in the body that fulfills that. So you see the vertebral arteries come together, they touch at the vertebral-basilar junction. It's the only place where two big arteries come together and make a larger artery. Everywhere else, the students, residents, you know, that artery goes up, it bifurcates, it becomes branched, and becomes smaller and smaller. In this case, two big arteries become even a larger artery. That's how important the basilar is. The basilar artery, if it does not work, there's no consciousness, there's no awareness, nothing is there. So is the meaning of hablul warid the basilar artery? This is a question for the ulama. But the idea that it more properly fulfills the definition of hablul warid than any other artery in the body. So the idea is very interesting, because if you take an anatomical view of this ayah, it says, the next verse, إِذْ يَتَلَقَّى الْمُتَلَقِّيَانِ عَنِ الْيَمِينِ وَعَنِ الشِّمَالِ قَعِيدٌ. Where is this artery, hablul warid? Where is the basilar? إِذْ يَتَلَقَّى الْمُتَلَقِّيَانِ, where the two joiners meet. إِذْ يَتَلَقَّى الْمُتَلَقِّيَانِ عَنِ الْيَمِينِ وَعَنِ الشِّمَالِ قَعِيدٌ. They're sitting on the right and the left with their knees bent. Qa'id. When you sit down in sajda, or you sit down in qu'ud, when you're doing salah, the bending of your knee, that's called qu'ud. So you see the bending of the knee as the artery comes straight up, it bends before it goes up. Wallahu alam, إِذْ يَتَلَقَّى الْمُتَلَقِّيَانِ عَنِ الْيَمِينِ وَعَنِ الشِّمَالِ قَعِيدٌ. The Mufassirin, they say that this has to do with the angels that are writing things down, but the anatomical description from the perspective of a neurosurgeon is perfect description of the vertebral arteries bending their knees as they come up now to join to become the basilar. What's more interesting is that if you look at this region, the vertebral-basilar junction, this is where the brainstem is. So this area here. And in that area of the brainstem, you have the reticular activating system, but you also have the nuclei which cause you to speak. So you speak because of your facial nuclei, your hypoglossal nuclei. So a thought turns into a nerve potential which causes speech in that region. That's where action now becomes these words. So listen to the next part of the verse. So I say that to me, Allah subhanahu wa ta'ala is describing the anatomy. ما يلفظ من قول إلا لديه رقيب عتيد. That a person doesn't even articulate a part of a word. من قول إلا لديه رقيب عتيد, except an angel is writing it down. Well, min, they say in Arabic, يفيد الجزئية, that even a part of a word, if it's even articulated, ما يلفظ من قول إلا لديه رقيب عتيد. The next verse is even more interesting. It talks about death. It wasn't until 1968 that Harvard proposed a new term referred to as brain death. We used to think that people were dead when their heart and their lungs would stop. Harvard proposed, no, there's something called brain death. That's the real death. So the next verse, it says, وَجَاءَتْ سَكْرَةُ الْمَوْتِ بِالْحَقِّ ذَلِكَ مَا كُنْتَ مِنْهُ تَحِيدٌ. That this is the thing that you really should be aware of, that when real death comes, that's when now your judgment starts. So if you look at those 4 ayat, those 4 verses, they're very, very interesting in that they're describing this incredible anatomy perfectly. I don't know who can write a book like that. Allah subhanahu wa ta'ala, He says in the Quran, وَلَقَدْ يَسَّرْنَا الْقُرْآنَ لِلذِّكْرِ فَهَلْ مِن مُدَّكِرٍ. That Allah made this Quran so easy as a reminder. Will you be reminded? I digress to say this to you because, again, Allah subhanahu wa ta'ala, if you look at us, our bodies, how can you have any other conclusion except that the Creator, He's the one who did this? And I say this to the people who are in America that are not of our faith, Christian, Jewish, Hindu, atheist backgrounds, that how can you challenge the idea that there's one God? And many people, they come now to Islam through these ways. So this is the patient after surgery where not even a cut on his eye, and he has 20/20 vision, and he's able to move his eyes on his own. So I want to show you also this other case. So last summer I was in the Indonesia hospital. Indonesia donated all the money for the hospital in the north of the Gaza Strip. And in Gaza, the location was in the north of Gaza, so this Gaza city. So for us to actually get through the Kerem Shalom crossing and to go to the North Gaza Strip was difficult, but I became one of 2 neurosurgeons that were able to be there. What's interesting in neurosurgery is that normally people are brought to us, but to actually be in the middle of a battlefield is very unusual for a neurosurgeon. So this is the location of the hospital, this little blue dot. I took a picture on my phone, and again, very challenging area. I don't know if I'll be able to play this. I don't know if you guys in the back there can you play this video? Are you guys able to play this video? It might be difficult. So I've never seen such destruction. If you look at those apocalyptic movies where everything is destroyed, there wasn't an inch of Gaza that wasn't completely desolated and demolished. And there's this term for this. They say mowing the lawn. 2021 isn't the first time that this started. That mowing the lawn meant, you mow the lawn because the grass got too high. Look at Gaza every 5 years, every 8 years. It's the same story again and again. Destroy the infrastructure. So again, I think it won't. I see, it's not embedded, okay. So again, this is another video, I won't show it to you, but in Gaza, there would be 80, 90 bodies that would come to the emergency room, pandemonium, no equipment. You would have the entire area around destroyed, hundreds of people under rubble, and that would happen multiple times every day. I'm an administrative physician for the most part, but in this case I was seeing easily 100 patients a day, operating day and night, doing our best to try and save these patients. This patient now presents because he's got a skull fracture, he's got spinal fluid coming out of his ear, his nose, his mouth, he has these raccoon eyes, And of course, one cannot save everybody. It's in Allah subhanahu wa ta'ala's hands. But this patient, he had the potential to be saved. I remember I came to the OR. The first day, they didn't have the equipment. They didn't have drills, all the things that I need to function. But subhanAllah, by the second day, they brought everything and allowed me to do very advanced surgeries. So here is the patient being prepped. Ultimately, we came in. This is an ENT physician. This is my assistant. This is a surgeon who's trying to finish his residency training and finalize his second year neurosurgery resident. All of these people were asked to evacuate Gaza at that time because it wasn't allowed to stay in the northern areas. All of them stayed. And this person, he came from Jordan. And we had anesthesiologists and so on, and there was difficult circumstances, flies in the OR, etc. But ultimately, we were able to perform. So alhamdulillah, we were able to rotate a flap. And this is called a pericranial flap, where as a surgeon, I stop when I cut down through the skin. I don't get to the bone and save a little thin area of pericranium, rotate it anteriorly, open the skull, and put it like a carpet underneath the brain. And that's called a pericranial flap. So we were able to do that, and that ended up sealing up all the spinal fluid leaks. Alhamdulillah, he did very well, and he's up and surviving and so on. Yeah. For me, I know I appreciate everyone clapping for me. I have to say, I went to Gaza for myself. I enjoyed it. These people, beautiful people, when they memorize the Quran, they memorize the Quran, but they're not proud of it. They're proud if they can memorize the Quran or say it, fi jalsatin wahida. If one of their children can say the Quran from Al-Fatiha to Surah An-Nas, no mistakes, one sitting, it's called jalsatin wahida, then they're proud. They feel my child did something. Memorizing the Quran like that with mistakes wasn't enough. So I say that, if we're able to see farther, it's only by standing upon the shoulders of giants. I believe that there's so much collaboration that can happen between Indus and Insight. I'm very, very astonished by this institution, its abilities, its growth. Dr. Bari just completely shocked me with the stories that he told. And I believe so much collaborations. I have other presentations perhaps we can talk about later, but from a research perspective, I believe that we can do so much here. We have multiple research activities that we're championing, and I believe that the most important thing is ideas. That if someone has a dream or a vision, whether in Pakistan or in the United States, of how they're going to advance healthcare, whether it's a new treatment, a new biomarker, a new innovation, a new device, that is the most important thing. Once one's capable of dreaming, our Prophet ﷺ, he taught us how to dream. He used to say that the people behind me should be dreamers, ulul ahlam. Now, ahlam means more than dreams, but people of knowledge, people of sincerity, people of taqwa. But the idea that he wanted people behind him, he used the term ulul ahlam, people who have this ahlam, which again, as I say in English, can be translated to dreams. But I always say this to the students, that if you're not ready to fail, you're not ready to succeed. So when it comes to research, be aggressive, think, be innovative. I think one of the most innovative, I would say, discoveries in human history was the number 0. 0 comes from the word zephyr in Greek, which comes from the Arabic term sifr, which is 0. So the idea that the 0 led to the binary code, led to the numerical systems. Of course, our Hindu friends, their history led to the idea of the 0 as a placeholder. But it wasn't until the Islamic era that the 0 was defined as it is today. 0 over 1 is 0, 0 over 0 is undefined. So it was the Islamic mathematicians who came up with the idea of 0. Even the idea of being nothing was something which was discouraged by the Christian church. هل أتى على الإنسان حين من الدهر لم يكن شيئا مذكورا. The idea that you're nothing, and there is something called nothing, required the Islamic thinking to define nothing. Is that not exceptional? And so the idea that we should dream and dream and dream with new treatments for cancer, new treatments for surgery, new treatments for brain tumors, new treatments for high cholesterol and so on. And that innovation is not purely scientific. Again, hearing Dr. Bev, and we did simply for the blood transfusions in Pakistan, what kind of sadaqatul lifelong, next 1,000 years will go to his hasanat. I mean, you want to talk about a great, beautiful investment. هل أدلكم على تجارة تنجيكم من عذاب أليم. That, you know, Allah subhanahu wa ta'ala is giving us an opportunity in our lifetimes to do beautiful work. I don't know who's more blessed than someone who can take care of a patient, wake up in the morning feeling excited to take care of a single patient, a single community, an entire country of people who need our help from the perspective of health, who can deliver the care personally and touch that heart, who can help grow that individual's mind and heart. In America, as we work, you're seeing that we're the first Islamic health system in the Western Hemisphere. Alhamdulillah, Insight was blessed to be the first Islamic health system in the Western Hemisphere. And I recall, when we went to Chicago in 2021, every system abandoned the hospital. We came and said, no, we'll take care of it. When we came to the hospital, Dr. Tajammul Hussain, who's so kind to me and so respectful of me, I'm more respectful to him. He came the first day a cancer patient came, and he had no money and he had no insurance. Dr. Tajammul came, treated him, and bought him shoes and bought him clothing. Imagine a physician in America saying, forget about doing it for free, I'm going to pay you. I'll bring you food, I'll bring you shoes. The patient started crying. No one in my family, no one in my community gave me so much love as this physician who first time he's ever met me. And he said, this is Islamic hospital, this is how we should be behaving. So may Allah subhanahu wa ta'ala allow us to live these ethics and do great things, and maybe we can collaborate, and so many good things can happen through our collective works. Wa jazakumullahu kulla khairan.
Jazakallah khair.